Hello friends, myself Sahana studying in Sri Venkateshwar College of Engineering in ISC Department 4SAM. I am here to explain about the human heart. Firstly, we can see the introduction of the human heart. Humans have known about the heart since the ancient times, although its precise function and anatomy were not clearly understood from the primarily religious views of earlier societies towards the heart. Ancient Greeks are considered to have been for the scientific understanding of the heart in the ancient world. Here, Aristotle considered the heart to be the organ responsible for creating the blood, but Plato considered the heart as the source of circulating the blood, and Hippocrates noted that the blood circulating cyclically from the blood body through the heart to the lungs. Aristotle at the 304 to 250 BCE, he noted the heart as a pump causing dilation of blood vessels and noted that arteries and veins both radiate from the heart, becoming the progressively smaller with the distance, although he believed they were filled with the air and not with the blood. He also discovered the heart valves. In the modern days, we can see William Harvey's that he written a book completely which describes the systemic circulation and the mechanical force of the heart, leading to an overhaul of the Galenic doctrines. Next is about what are the interesting facts about the heart. Here we can see that each day your heart will beats about 1 lakh times. Each minute your heart pumps 1.5 gallons of the blood, and heart disease is very first reason for the cause of death. A normal heart valve is about the size of a half-dollar coin. The largest heart ever recorded belonged to a grey whale. Next, we can see the functions of the human heart. Here we can see what are the functions of the human heart. It will pumps the oxygenated and nutrient-rich blood to the body through the blood vessels and pumps the deoxygenated blood containing waste to the lungs where gas exchange is being done to the environment where it occurs. Here we can see the four chambers of the heart is right atrium, right ventricle, left atrium and left ventricle. In this picture we can see the what are the chambers that we can see in the heart is superior vena cava and pulmonary vein, right atrium, pulmonary waves and tricuspid valve, inferior vena cava, right ventricle, left ventricle and aorta, pulmonary artery, pulmonary vein, left atrium, mitral valve and aortic valve. Firstly, what is atrium? Here we can see the function that the upper two chambers of the heart and it receives the collected blood. Septum where it is the muscle that divides the heart into the right and left valves. In the valves there are four types, that is tricuspid valve, pulmonary semilunar valve, mitral valve and aortic valve. Purpose. Here it will prevent the backflow of the blood, keep the blood flowing in one direction. And the ventricles is the lower two chambers of the heart will pump the blood out of the heart. Heart as a pump system. Here, heart is sort like a pump or two pumps in one. The right side of your heart receives the blood from the body and pumps it to the lungs, and the left side of the heart does the exact opposite to it. It receives the blood from the lungs and pumps it out to the body. The human heart is very strong and capable of pumping the blood up to 30 feet distance. An average heart beats maximum of 70 to 80 beats per minute and is considered to be the healthy person. The efficiency of the heart can be maintained and improved by performing the physical activity. The heart is also called as a double pump because each side pumps blood to a different circulation. Deoxygenated blood from the body drains to the right side of the heart, and this is the first pump that sends blood to the lungs called the pulmonary circulation, where it becomes oxygenated and releases the carbon dioxide. Cardiac cycle. The cardiac cycle is a sequence of events in which the heart contracts and relaxes with every heartbeat. At the beginning of the cardiac cycle, the ventricles are relaxing. As they do so, they are filled with blood passing through the open mitral and tricuspid valves. After the ventricles have completed most of their filling, thus the atria contract, first forcing for further blood into the ventricles and priming the pump. Next, the ventricles start to contract. As the pressure rises within the cavities of the ventricles, the mitral and tricuspid valves are forced to be shut. As the pressure within the ventricle rises further, exceeding the pressure with the aorta and pulmonary arteries, the aortic and pulmonary valves will open. Thus, the blood is ejected from the heart, causing the pressure within the ventricles to be fall. Simultaneously, the atria refill as blood flows into the right atrium through the superior and inferior vena cava and into the left atrium through the pulmonary veins. Finally, the pressure within the ventricles will fall below the pressure within the aorta and pulmonary arteries. Thus, the aortic and pulmonary valves will close and the ventricles will start to relax, and thus the mitral and tricuspid valves open, and thus the cycle will begin again. Here we can see the cardiac cycle. Firstly, the atrial contraction and further is isovolumic contraction, and it is performing the ventricular contraction and ventricular ejection. Further is isovolumic relaxation. Thus, it will perform the ventricular filling and it is sent to the atrial contraction. This is the cycle of the cardiac human heart. Here the cardiac output. How the cardiac output is been measured. Firstly, the cardiac output is a measurement of the amount of blood that is pumped by ventricular or stroke volume in 1 minute. This is calculated by multiplying the stroke volume SV by the beats per minute of the heart rate, it is HR. So that CO is equal to SV into HR is nothing but stroke volume into the heart rate. The cardiac output is normalized to the body size through the body surface area, and it is called as the cardiac index. And the electrical conduction of the human heart. Here the normal rhythmical heartbeat, called the sinus rhythm, is established by the heart's own pacemaker. The sinoatrial node is also known as the sinus node or the SA node. Here the electrical signal is created that travels through the heart, causing the heart muscle to be contract, and the sinoatrial node is found in the upper part of the right atrium near to the junction with the superior vena cava, and the normal resting heart rate is called as the sinus rhythm, created and sustained by the sinoatrial node. A group of pacemaking cells found in the wall of the right atrium or the cells in the sinoatrial node do this by creating an action potential. Here we can see in the picture how the sinoatrial node and atrioventricular node has been performed by the electrical conduction in the human heart. Nextly, we can see the heart diseases. Here, the cardiovascular diseases, or which includes the diseases of the heart, are leading for cause of the death in the worldwide. The majority of cardiovascular diseases is non-communicable and related to the lifestyle and other factors also becoming more prevalent with aging. The disease is a major cause of death, accounting for an average of 30% of all the deaths in 2008 globally. And further diseases is heart failure, cardiomyopathies, coronary heart disease, valvular heart disease, cardiac arrhythmias, and congenital heart disease. Here we can see diagnosis. How the heart disease is being diagnosed by various types. The heart disease is diagnosed by the taking of a medical history or for a cardiac examination and further investigations including the blood test, echocardiograms and by using the electrocardiograms and imaging. Other invasive procedures such as cardiac catheterization can also play a very important role in the diagnosing of the disease. And by using the blood test will play a very important role in the diagnosis and even for treatment of many cardiovascular conditions. And by the heart sounds and by using the electrocardiogram, this will using a surfaces electrodes on the body, and it is possible to record the electrical activity of the human heart. This will tracing of the electrical signal is called as the electrocardiogram. Here we can see how the cardiac cycle can be done by using the signals. What are the reasons for blockages of the blood vessels? Here, the coronary artery disease is a common heart condition that the major blood vessels that will supply the heart will struggle to send the enough blood, oxygen and nutrients to the heart muscle. Therefore, the cholesterol will deposit plaques in the heart arteries, and inflammation are usually the cause of coronary artery disease. Besides, the high cholesterol damage to the coronary arteries may be caused by diabetes or insulin resistance, high blood pressure, not getting enough exercise such as it's a sedentary lifestyle or for smoking or tobacco treatments. Here we can see the treatment for the coronary artery diseases by using the coronary stents. A cardiac stent is a mesh tube or the size of a finger or smaller that is made up of a cobalt chromium alloys or the stainless steel that it is placed into an arrow. The main purpose of the cardiac stent is to make sure that the circulatory system of the heart is running in proper order. The stent enlarges a part of the artery which helps improve the blood flow. This reduces and in some cases even eliminates the chest pain symptoms. Through the process restenosis, the stent is coated with certain medications that prevent it from narrowing and clogging. Other treatments can be done by the using pacemakers. A pacemaker is a small device that is placed or implanted in the chest of help control the heartbeat. It's used to prevent the heart from beating too slowly. Implanting a pacemaker in the chest that requires a surgical procedure. A pacemaker is also called a cardiac pacing device. There are three types. Firstly, single chamber pacemaker. This type usually that carries the electrical impulses to the right ventricle of your heart, and the dual chamber pacemaker is the type that carries the electrical impulses to the right ventricle and right atrium of your heart to help control the timing of contractions between the two chambers. And the biventricular pacemaker is also called a cardiac resynchronization therapy is for the people who have heart failure and heartbeat problems. This type of pacemaker stimulates both of the lower heart chambers to make the heartbeat more efficient. Pacemakers has two parts. It is pulse generator. In this picture we can see how the pulse generator has been implemented. Firstly, it is a small metal container houses a battery and even for the electrical circuitry that will controls the rate of electrical pulses that is sent to the heart, and LEDs or electrodes. One, two, three flexible insulated wires are each that is placed in one or chambers of the heart and deliver the electrical pulses to adjust the heart rate. However, some newer pacemakers don't require LEDs. These devices called leadless pacemakers are implanted directly into the heart. Further treatment is defibrillators. If you find a person who is unconscious, unresponsive or not breathing normally, a defibrillator is a device that gives a high energy electric shock of the heart of someone who has collapsed and is in the cardiac arrest. There are a number of makes of defibrillator. They all do same job and each time that talks through you what need to do. There is no need to worry. You won't be able to shock someone who doesn't need it as the AED will only deliver a shock if it's required. There are three types of defibrillators such as AEDs, ICDs and WCDs. An AED is a lightweight or it is a battery operated portable device that will check the heart rhythm and sends a shock to the heart to restore normal rhythm. The device is used to help people having the cardiac arrest, and ICDs are placed through surgery in the chest or stomach area where the device can check for arrhythmias, where arrhythmias can interrupt the flow of blood from your heart to the rest of your body or cause your heart to stop. The ICD sends a shock to restore a normal heart rhythm, where the WCDs have sensors that is attached to the skin. They are connected by wires to unit that checks your heart's rhythm and delivers the shocks when needed. Like an ICD, the WCD can deliver low and high energy shocks. The device has a belt attached to a vest that is worn under your clothes. Your provider will fit the device to your size. It is programmed to detect as a specific heart. Here we can see the AED. It is an automated external defibrillator. It is a device that is fixed to the human. Here we can see how the defibrillator paddle and the electrical current ventricles are being implemented by using the defibrillation process. At last we can see the conclusion. The heart is a life-giving or ever-beating muscle that will pump the oxygenated and nutrient-rich blood to the body through blood vessels. As a conclusion, the cardiovascular disease is a disease which is highly prevalent in the Malaysia and accounts for 23.1% of death in Malaysia. The heart is a very vital and important part of the human body. The arteries, capillaries, and veins work in a conjunction to keep all the tissues healthy by providing the oxygen and other nutrients while removing carbon dioxide and other waste through continuous blood flow. We use a various methods to overcome the heart disease by using pacemakers and defibrillators and various methods. At last, thank you everyone.